Hey, good morning, Kevin. Good to be with you.
Congressman, the House GOP health care bill, your feeling about what has been presented thus far?
I think it needs some improvement, and today's a big day on the bill. It goes through the Budget Committee that I sit on, so we're going to get to hear the bill and make some suggestions to change it and improve it. So I'm excited that we're actually working on this bill, but I do want to see some changes in it. I've worked with the governor's office. I visited with Senator Cotton about it and lots of other people. So, we're trying to get a good plan in place. This bill needs some work on it, but I've got faith we're going to be able to get a good product out eventually. They say making legislation is like making sausage. You don't necessarily want to watch the process, but hopefully you get something good on the outcome.
What are the big issues here with this bill, and what specifically would you like to see changed? Where's the resistance with it?
Well, there's an issue with how long the Medicaid expansion goes in the bill. There's an issue, and these are all amendments that will be, or resolutions that will be offered in the Budget Committee this morning. The bill doesn't include block grants for states, which I think is a much better way to fund Medicaid for states, is through a block grant system, because it gives the states so much more flexibility on how they manage their system. And then there's going to be a resolution offered for work requirements. If you're able-bodied, working-age adult, and you're receiving free health care benefits, then there's going to be a work requirement amendment offered. And finally, it's an issue that deals with the tax credit. This one's a little more complicated. If you're in a group plan, when you buy your health insurance, you get to buy it with pre-tax dollars. So everybody who buys their insurance out of a group plan gets a tax deduction on purchasing their health insurance. If you're an individual, you don't get that same deduction. You can't use pre-tax dollars to buy your health insurance. So the bill attempts to even the playing field on that for individuals buying plans. There's another issue. If you're a low-income person, you're not going to have enough taxable income that a deduction does you any good. So the bill right now has included tax credits, which, the difference between a deduction and a credit is a direct full amount reimbursement from the government, where a deduction is you get a discount based on what your tax bracket is. So I hope I haven't been too confusing here, but it is more of a confusing issue.
Yeah, well, and that was something that was interesting that the president said. I mean, who knew it was this complicated? I think everybody knew it was a complicated issue. Why the surprise about that?
So what I would like to see is to use those tax credits for low-income individuals, but after you cross a certain threshold of income, just revert it back to a tax deduction like everybody who buys a plan out of a group plan gets. So those will be the main issues, I think, that are discussed in the Budget Committee today. The bill, if it passes out of the Budget Committee, goes to the Rules Committee, where final amendments can be made before it goes to the House floor and then on over to the Senate.
Congressman Bruce Westerman, maybe you can help me sort out some politics here, things that I think a lot of people don't understand. Why the rush, I guess? I mean, this has issues in this bill that the AMA, the AARP, any number of organizations have come out against. And like you mentioned, Senator Cotton and other Republicans saying they can't support it in this form. Speaker Ryan, Vice President Pence saying, this is it. This is it. This seems like the way to do it. I mean, shouldn't this be the idea to look at the idea and sort it out? Why has the plan they presented or said the one that they're trying to push through? Help me understand that.
Well, there's a time frame that's somewhat self-imposed. It also has to do with the process we're using called budget reconciliation, which allows us to move this bill through with only 51 votes in the Senate, so you don't have to go through the cloture rule. There is a clock on budget reconciliation, but I'm in total agreement that we need to slow down and get this right. And there's been enough pushback that you're going to see some amendments get added to the bill. And, the only way to slow something down is to come out and say you're going to vote against it in its present form, because if you don't have the votes, it's not going to pass anyhow. So as fast as some people would like to push it through, I think others are taking a more practical approach and saying, let's slow down, let's give people a chance to look at this, and let's get it right, because this is pretty much a once-in-a-lifetime opportunity to change a huge entitlement program that's in desperate need of changing. Long before the Affordable Care Act came out, there needed to be changes done in Medicaid. So I'm excited to be a part of it and to be able to have my input go into the bill and how we might possibly amend it.
Congressman Bruce Westerman, thank you for the time this morning.
It's always a pleasure to be with you, Kevin.
Enjoyed it. Have a good day today.